In the workshop today, we will have people wearing different hats. We will have researchers, clinicians, commissioners, allied health professionals, patients, carers. There will be academics, statisticians, third sector organisations, press, PR people, and almost all of us have had a family member or a close friend who's accessed health services over the past 2 or 3 years. And for many of us, it's not just family or friends, it's ourself. Whatever hat you were wearing when you came through the door just now, healthcare and medical data is important to you, not only on a professional basis, but on a personal level. Data. Data, that small word, massive importance. The Oxford Dictionary definition, a mass noun, facts and figures gathered together for reference or analysis. In Latin, the plural of datum. I share data on a personal level. You see, I am a statistic, but behind my Northern Ireland Health and Social Care number, I am Margaret Grayson, a person. Talking to clinicians and researchers, I want to acknowledge your part in audit, in expert analysis, monitoring patterns of patient care that drives improvement in that care, that asks the right research questions, that affects outcomes. Asking the right questions of the data available for me has meant finding the right surgery technique for my mastectomy, the right combination of drugs in my chemotherapy, the dose, fractions and technique in radiotherapy, the right aromatase inhibitor that I took this morning and have done for the past 11 years, and some answers on the long-term effects of living with cancer, lymphedema, for example. I believe as a patient that I have a responsibility to the rest of society in permitting my data to be used. But I also have the right to ask clinicians and researchers, or perhaps rather demand, that my data is used. Remove the barriers, use for purposes of audit, comparison, research. Ask questions and find answers for me and for all the other patients like me. I said before that my health and social care number is a proxy for Margaret Grayson. I want that data to be used in ethical research. Oh, I want you to be careful with data, Margaret, but I don't want data, Margaret, to be locked in a box. Padlocked? Probably triple padlocked, as access to data, Margaret, is becoming more and more difficult. I know the legislators among you will say they are protecting real Margaret. But can I ask you, are you protecting Margaret or yourself? Oh, and one thing, I don't want you to sell data, Margaret, to an insurance company. I have asked the views of my fellow members of the Northern Ireland Cancer Research Consumer Forum. Here are some of the snippets. Use it. Benefit others. Look for initial permission for secondary use with safeguards in place. Anonymise. Pseudo-anonymise. For others, anonymity is not an issue. Can I quote one who said, I benefited from the generosity of others. It would be churlish in the extreme to deny that to other people. A widow who said, use my late husband's data to help others. All these people are passionate about wanting their data to be used, but all want safeguards around the whole selling issue. Let me share some group statistics from my own personal cohort. 7 of us were diagnosed with breast cancer in 2004. We became friends, a common bond, cancer. By 2009, I had been to the funerals of the other 6. I want those outcomes changed for people who are diagnosed in 2015. 7 people who become friends. This conference is all about cancer research, and central to all that is presented over these 4 days is data and how it is used to benefit and affect prevention, diagnosis, treatment, services and care for those living with cancer. Patients are a central part in working in partnership with you. Perhaps in your area, in your professional life, You don't often have the opportunity to speak to people behind those numbers and statistics, but over these 4 days, you have that opportunity. There are over 80 patients and carers here, people whose lives have been impacted by cancer, people who are as passionate as you are, and we are here to work with you, to support you, to further the research, not to hinder. I am passionate. I talked about my 6 friends, but also I don't want others to sit in a hospital room, as I did with my 32-year-old niece Elaine, with her husband Peter, and as she cuddled her baby son and said goodbye to him on the day that she died with non-Hodgkin's lymphoma. So take this opportunity to work together, to make better use of our data. Instead of being overprotective and restrictive about it, let us find ways of sharing it. Let us get the message out to the wider audience that it is good to share. Thank you.